the dominant strain in major metros, but in several other parts of the country, would you say that Delta is still alive, a more severe form of the variant that can give you more severe disease is still alive?
Yes, there is a mutation of Delta virus. Now we are finding the Omicron strain, though it has came from South Africa, but we have got a couple of cases in India right now. So previously it was alpha variant, beta variant, gamma variant, delta variant, and now it is Omicron, right?
Yeah. All right, let me take the next question to Dr. as well. What do you know about the Omicron variant and how it affects kids and teens? And are the current vaccines, Dr. Sreevatsa, any effective against Omicron variant? I understand there are various studies that are going on right now, and we are still to get a hang of what vaccine actually does not lead to immune escape against Omicron. What are your thoughts on this?
See, whenever we have a virus, viruses usually mutate, and coronavirus is no exception to that. So we had, as Madam pointed out, alpha, beta, gamma and delta, which got the havoc in the last year, December 2020, and now we have Omicron, which is a B11529. So there are two main concerns. That is why the WHO has labeled it as variant of concern. One, it is rapidly infective. Infective meaning the doubling time is 2 to 3 days. For the Delta virus, it was 5 to 7 days. So it is rapidly infectious compared to the previous variants. And secondly, the antibody response to the Omicron may not be, for example, if you are vaccinated or been previously infected, the antibodies may not give you 100% infection and protection against infection with Omicron virus. This was also pointed out in the South African study where 25 to 30% of vaccinated people were infected with Omicron. That is called a breakthrough infection. So this was quite common and scary. And also compared to the previous outbreaks, younger individuals around 25 to 30 years of age, university going students and women are more likely to be infected. If you remember the Delta, we had elderly patients or persons with comorbidities who were infected. But Omicron, affects younger patients and women more compared to the elderly patients. Even when someone is vaccinated or infected, they are still prone to develop infection. There is some laxity and, there is a public opinion that it may not be very, cause serious infection or hospitalization or mortality. But, considering the huge number of people that are going to get infected, the burden on healthcare is still going to be huge, and we can't be complacent about these public health measures. And as far as vaccines are concerned, this Omicron has what is known as humoral escape. That means it can escape the antibody which were previously formed. So there are guidelines from the WHO that booster doses may be needed in preventing Omicron. So I think, just because it is not causing as much mortality as the Delta, because the numbers are huge, it is still going to be a burden on our country.
Right. Dr. Nivedita, can I take the same question to you as well about how do you think Omicron is acting up on kids and especially older or younger adults, if we can call them that, those teenage groups? There are several countries who are already giving now booster doses, making it mandatory for young kids. US, for example, the FDA, just this morning news coming in that it's going to pass out sort of orders to say that now people and in fact teenagers above 12 should start taking the booster dose mandatory as well. Israel is an example where they're giving not one but 2 booster doses to people.
No, yet we have not started our adolescent age group that vaccination. So in India, question doesn't arise now for booster dose, because when primary vaccination has not been started, so where the question comes for booster dose. So we are lacking behind those countries because our 1/3 of population only completed the vaccination. Others remain unvaccinated. And so the teenagers, adolescent group, and the younger age group, more than 60 years, and population with comorbidities should be vaccinated first. So regarding booster dose, we haven't yet started immunization for the adolescent age group. So where the question comes for booster dose.
Right. And staying with you, ma'am, how effective do you think are the current treatments for battling Omicron? What is the treatment, for example, for Omicron? We'd seen a combination of, sort of multivitamins and sort of treatments coming in when Delta was in place. Any extra precaution as well that you can take our viewers through if people with diabetes need to take even with Omicron? Dr. Nivedita?
Yeah. So for current treatment, so as in case of Delta virus, corticosteroids and IL-6 receptor blockers, that is interleukin-6 receptor blockers, still be effective in managing the Omicron virus. And everyone should get vaccinated. It is the best battling way to combat Omicron. And regarding the diabetic patients, so they should follow the COVID-19 protocol, like they should wear masks, maintain hand hygiene, and maintain social distancing. And they should be fully vaccinated. Unless and otherwise they are fully vaccinated, they are at risk of getting infection through Omicron.
I see. Now, which vaccines have been approved by the government of India for the age group of 15 to 18? If Dr. Sreevatsa, you could take us through that. At the moment, only Covaxin is being administered, but there are several others which have been given clearance by the drug controller, isn't it?
Yeah, I think there are 5 vaccines which are undergoing trial. One is by Zydus, the other one is Bharat Biotech and Covaxin, as you rightly pointed out. We also have one from Johnson & Johnson, etc. But right now, the Government of India and Ministry of Healthcare has given clearance only for Covaxin 15 to 18 years for kids between 15 to 18 years of age. I think for pediatric use, I think we still have, we don't have much stronger data. Maybe in a couple of months we can give a go-ahead for much younger kids and for other vaccines as well. But as of today, only Covaxin is recommended.
I see. That's the only option because that's the only stock we have in the country as of this moment. Now, type 1 diabetes, I just want to shift our focus to diabetes now, is more common amongst children and teenagers. Are the symptoms of type 1 diabetes different from those of type 2, Dr. Nivedita?
No, so far as symptoms concerned, both are similar. In type 1 and type 2 diabetes, both are similar symptoms like fatigue and increased hunger, blurred vision, frequent urination, dry mouth, stomach upset, and there is excessive thirst, numbness of hands, and there is a tingling sensation of hands and feet. So in both cases, you will get almost similar symptoms. But one thing I would like to say, in type 1 diabetes, what happens? The body's immune system destroys the insulin making cells of the pancreas, that is the beta cells. But in case of type 2 diabetes, pancreas makes less insulin than the body needs, and the body cells stop responding to insulin. That is, insulin resistance gradually develops in case of type 2 diabetes, and which was not in case of type 1 diabetes. Because in case of type 1 diabetes, we will not get at all insulin. So we have to supplement insulin from outside, right? And type 1 diabetes is common in children and younger adults, whereas in type 2 diabetes, you will get in older adults.
I see. All right. Thanks for that. I think it's time that we can slip into a quick break. When we come back, we'll continue with this conversation. Stay tuned.
सच दिखाते हैं ताकि दुनिया के बाजार में आजादी सस्ती न बिक जाए। कुर्सी पे बैठने वालों को जमीन की अहमियत याद रहे। सच दिखाते हैं हम ताकि पैसे की चमक से कभी हुनर न पड़े फीका, खुद गर्जी खोखला न बना दे सोचने का तरीका। सच दिखाते हैं हम ताकि अच्छे विचार और आदर्श बस किताबी बातें न रह जाएं।
के अंदर एक नया जोश और उत्साह पैदा हुआ है।
एक बेहतर कल चाहते हैं हम, इसलिए सच दिखाते हैं हम। एनडीटीवी इंडिया, जुबान पे सच, दिल में इंडिया।
NDTV wins the trust vote once again.
This is now reality check. NDTV 24/7 has been awarded the most trusted news brand of India.
Still many say independent, unbiased journalism of integrity.
Thank you for your endorsement of serious journalism.
Good evening. It's 8 o'clock. You're watching NDTV for the news that matters, the news you trust. You said in this report that this crisis, like no other, will have a recovery like no other.
This is a crisis, it's a global crisis that's not going to be solved locally.
When we talk of a digital health mission in a country like India, where there are so many different standards of access, how do you actually look at that?
Digital divide does not mean having a device in everybody's hands. So you have to design it for universality, even when you're using a digital backbone.
Priya, for you, when you had stood in the dock, as it were, when you gave your defense, and you said, my only defense is the truth.
Absolutely. And I feel that sexual harassment at the workplace has got the attention it deserves.
NDTV, the news that matters, the news you need, at 8 o'clock.
Only on NDTV 24/7.
Welcome back. You're watching Bits and Facts on health and wellness, and we are in conversation with our experts. Let me take the next question to Dr. Sreevatsa. Dr. Sreevatsa, what is the congenital heart disease, CHD as it's often called? How common are these heart defects? Do people with CHD have to live with this condition for life?
Yeah, see, heart is a very complex structure which starts to develop from around 7th day of intrauterine, or when the baby starts to develop in the womb. By 10th to 21st day, the heart starts to form and takes complex changes to develop into a fully grown heart. But there are so many environmental, genetic, and drugs, or these factors can lead to malformations in the development of heart, and by common layman's term, you can call them birth defects or CHD, as you rightly pointed out. It's not so uncommon. Almost 1% of live births will have this heart defects, and the common heart defects can be either they can be simple, like we call them holes in the heart, or wall problems with the walls in the heart. There can be wall blocks or leakage in the heart vessels, but sometimes they can be complex. The complex congenital heart diseases, they include a multiple combinations of these, like having a large hole in the heart, along with blockage in the walls, or the great arteries known as the aorta and pulmonary arteries being malformed. So these are it's a spectrum starting from mild to be very severe, sometimes causing death inside the womb of the mother. So the mild defects are usually detected in late childhood or early adulthood, but these complex diseases present at a much younger age, around early infancy. The what is called a blue baby, they will have a bluish discoloration of the skin, and they will have breathlessness. They'll have fast heartbeat, that is palpitations, and sometimes they might have syncope or loss of consciousness. So these are the common conditions that common symptoms that the children can commonly present. And yes, I mean, most of these were not treatable, say, a few decades back, but with the advent of modern surgery, modern surgical technique and interventional technique, we are able to tackle even up to 80 to 90% of these children. But even when they are treated, they are not cured. They need to be on constant surveillance, throughout their life, because some of the sequelae can still remain, and they can present late in the adulthood or later years of life.
I see. Let's go to the next question then. The risk for diabetes increases with age, making diabetes common in elderly, while type 1 diabetes is generally detected at a lower age, at a younger age. What is the relationship between maternal age and susceptibility of type 1 diabetes in children, Dr. Nivedita?
Well, maternal age at delivery was strongly related to the risk of developing type 1 diabetes in the children. Now, risk increased by 25% for each 5-year band of maternal age. That means if the maternal age at delivery is 35 years or more, for first delivery, 35 years or more, then risk of increase by 25% to develop type 1 diabetes as compared with the children whose mother were 25 to 30 years of age. So, risk increased by 25% for each 5-year band of maternal age.
I see. All right, let's move on to the next question then. Living with heart diseases from childhood, it's scary, right? What are some of the frequent complications for children with congenital heart diseases? Dr. Sreevatsa, if you could answer that.
Yeah, congenital heart diseases, many a times these children, especially the ones with complex congenital heart disease, as I mentioned, there will be holes in the heart. Because of these, they are prone to infection of the heart's walls. This is known as infective endocarditis. I think especially kids with infective endocarditis are prone to develop infection of the heart wall, which is a very serious and a dangerous complication. A simple procedure like a dental extraction can cause infection of the heart wall. So that is one dreaded complication that people living with congenital heart disease should be aware of. The second complication that these kids are prone to are known as arrhythmias, or variations in the heartbeat. They can have either fast heartbeat or sometimes they can have a slow heartbeat leading to loss of consciousness. So this is some the other complication that they can have. And when such babies have there is what is known as the mixing of a pure and impure blood, that leads to the bluish discoloration and the oxygen levels being low. When the oxygen levels are low, they will have very high hemoglobin levels. This is medically known as polycythemia. When someone has polycythemia, they can have fatigability, poor quality of life, and sometimes it can cause clots in the brain's arteries, which is because of the high hemoglobin level. So they need to be on repeatedly. We need to remove blood from their bodies. So this is one more complication. And women who have CHD, women who with these heart defects, especially those with complex congenital heart disease, have to be very cautious while becoming pregnant, because pregnancy and having a complex CHD is like a very dangerous combination, and many times we advise them not to undergo pregnancy at all. And in addition, there are other complications like uric acid levels are quite high in such patients. They can accumulate in the joints, causing joint swellings. So there are multiple complications. The most and the scariest of them is infective endocarditis that people should be aware of, especially people with CHD, complex CHD are prone to develop infective endocarditis.
I see. Let's take the next question then. Is it true that psychiatric conditions such as exposure to trauma, PTSD, depression, anxiety disorder, suicidal ideation, etc., frequent among children with type 1 diabetes? Dr. Nivedita?
No, actually, less is known about how trauma exposure and symptoms of post-traumatic stress disorder may influence type 1 diabetes. And healthcare providers working with children with type 1 diabetes should ask about psychiatric symptoms and refer to them to appropriate place to optimize the diabetic care.
Okay. Your thoughts, Dr. Sreevatsa?
Especially as a cardiologist, if you ask me what are the challenges to kids, in our country especially, you rightly pointed out that India is the diabetic capital of the world, and we are, the kids nowadays with the lockdown and all, not going out, no physical activity, we have become the obesity capital of the world also. The childhood obesity is a major concern. As per a study, 1 in every 3rd Indian child is obese, and these are the ones who are going to develop to be the citizens of the future India. And the risk of diabetes, heart disease, obesity, cancer is very, very high. With the rapid urbanization and industrialization happening in our country, the trend towards fast food and very limited physical activity, getting stuck to video games and not moving around. This is something that is very alarming, and I have seen small children coming with diabetes and heart disease, and people as young as 18 years having a major heart attack and undergoing angioplasty or bypass surgery. This is something that is very alarming and actually more serious than COVID. That's what I feel.
Oh, wow, that's alarming indeed. And for people to actually take note of this, then Dr. Sreevatsa, tell us this. Most people don't think heart problems is an issue amongst teenagers, right? But you are saying that teenagers have heart abnormalities and it can lead to very severe health problems.
Yeah, no doubt in that. Heart disease is considered a disease of elderly or old age people. But many times you see, kids or in their teenagers coming to our clinic, not just with heart disease, but palpitations or diabetes, high cholesterol levels. There are certain rare disorders known as arrhythmias, which can be present from birth, or as I earlier mentioned, we had congenital heart diseases or defects in the heart walls, or they can present in this age group. Also, diseases known as rheumatic heart disease, which can affect the heart. These can also be seen in teenagers or young children. So heart disease is not just a disease of adult population, but it equally can cause hazardous dangerous complication in children also.
I see. So that was about heart diseases. Dr. Nivedita, do you want to talk about diabetes being diagnosed in young people? I know through the pandemic, and especially because of steroids that was given as treatment through so many people who got COVID, got long COVID as well. A lot of young people who had underlying diabetes or people who had diabetes running in their family, they sort of had resurfacing or early surfacing, if one can call it that, of diabetes. To these kids, to these young adults who've now been diagnosed with diabetes, is this going to be a lifelong phenomena, or do you think there is a way that one can actually walk out of it?
No, actually, in all cases, they were not developed full-blown diabetes because of use of steroids during the COVID attack. So they got high blood sugar level, but as they withdraw the steroids from the treatment, blood sugar come down to normal level, but not in all cases. Some cases may develop full-blown diabetes after this. So the population who get the diabetes, accordingly we have to treat them, and accordingly we have to modify their lifestyle. So not all the people are getting diabetes.